Hi there, and welcome to A New Way to Age with Medical Aesthetics. So today's show, we're going to have a really great show today. So today's show, we're going to actually feature the HCG Diet, and we're going to have a live client who's lost 100 and something pounds on this program. I'll be sitting with Dr. Walter. Also coming up, we are going to focus on a new procedure that is new here to medical aesthetics, and it's called cool lifting. It is an instant gratification machine if you're looking for something to get rid of those fine lines and wrinkles quickly. I will also be interviewing the skin medical line rep that we have here at Medical Aesthetics, because we use the product with the cool lifting as well. And so we're looking forward to today's show. Hope you enjoy. Hi everyone, and welcome to A New Way to Age. I'm sitting in Medical Aesthetics today and with Dr. Walter again, Medical Director of Medical Aesthetics of New England. Today's show is going to be a little different. The last shows that we focused on were the hormone therapy treatments that they offer here at Medical Aesthetics. But today's show is going to be all about the HCG diet, which they offer here. So that's kind of a mouthful, but Dr. Walter, what is the HCG diet and the HCG component?
So the diet is it's a full program. We use a medication called HCG, and it stands for Human Chronic Gonadotropin. I'm just going to call it HCG from now on. It's done with injections. It's a very low-calorie diet, and it's very, very effective. The shots people sometimes worry about because they have needle phobia. But if you already look online, there's a video that we have on our website where I show people in detail how to do it. And when you come in and start the diet, I show them specifically how to do the shots. And at most, it's like a mosquito bite. It's not like a vaccine or anything that people get worried about.
Okay, so it doesn't hurt, so that's a good thing, because I'm sure the minute people hear injection, they get a little bit worried about that.
Right.
So I read up on the HCG diet, and it consists of a 500-calorie diet itself.
Yep.
So that's, I can hear people saying, well, if I ate 500 calories, I would lose weight anyway. So why is this different than any other diet?
I mean, I hear people say that to me all the time too, and my answer is yes, 500 calories, people can lose weight, but have you ever tried it? And it makes it really difficult to stay on it for more than a few days. So what the HCG does, it actually makes the hunger less of an issue. It's not really an appetite suppressant, which is important because some of the prescription medications are appetite suppressants, and they can have issues with blood pressure or heart rate, and this doesn't do that at all. People have to remember they're not living on 500 calories a day. A woman might be living in 1,800 or 2,000, a man might be 2,400 or more, and you're actually taking in 500 calories, which is part of the diet, and all the rest of that's coming from stored fat, so you're getting it from here and here, and that's how you lose the weight. Our most common program is a 40-day program, and people will lose 20 to 25 pounds on an average, and that's most people. We've had a few older people that are not that active, and they've lost maybe 16 or 17 pounds over the 40 days. And we've had other people lose 40 pounds, but that's really kind of an exception. So 20 to 25, if you figure on half a pound a day for the 40 days and feeling good and having, it being a safe diet, it's really quite effective, and people really like doing it besides seeing the weight loss.
Sure. So there's a 40-day, and there's another one too, correct?
21
day. Okay.
Yeah, you basically get twice as much for just a little bit extra money. We steer people very specifically towards the 40-day because the science really shows it takes 20 to 28 days to change habits. And if you do a 21, you lose the weight. But again, the long-term goal is to keep the weight off. Mm-hmm. The other important thing we haven't talked about yet is we have a diet coach, and she's lost about 85, 90 pounds in the diet before she even worked with us, and she's a very important part of this because she helps people through all the nuances and the day-to-day issues that sometimes can crop up.
Okay, all right. So So I can see it's for men and women. If somebody just calls and says, I'm still so hungry, is there something that they can get for that? Or
there's a prescription that I'll give, and we try not to. I don't start out with people getting the prescription because, again, that is a stimulant. It is effective, but most people by the end of the first week, they just find that they sometimes have to remind themselves to eat. So it is available, but again, I don't just give that automatically. Some diets, you just get that and head out the door. The other thing is with the diet coach here, and people have access to us during all the diet. And during the whole time, they can text or email or give us a call or call the diet coach, just to kind of help them through. Sometimes there'll be a few days when you may not lose weight, and the people get kind of upset about that, and it just helps explain to them that's part of the process.
I see. So I have read where there's drops for HCG, but you find that the injections are the way that people really lose the weight.
The drops, the injections are much more consistent. The drops, there's homeopathic drops, and the FDA actually said a few years ago that those are illegal. There's also non-homeopathic drops, but they really have to be taken a very specific way, and most people don't do that correctly. We just find the shots are just consistent, and if people do the HCG diet here, they get everything just all in one package. They get the medication, they get all the syringes, they get the rubbing alcohol to clean the skin, they get a little sharps container. Probably 12 or 15 different things we send them on the internet about the diet, how to travel with it, what kind of moisturizers to use, those kind of things.
Okay.
Because very important is it's not only losing weight, it's keeping it off. And people, I think, understand that if they go back to eating like they did before, the weight's going to come back on again.
Just like any other diet.
Yep. It's a low-carb diet, too. It's that part's a little bit similar to the Atkins, but I think the HCG injections are what's unique.
Okay, so basically it's no carbs, no oil, no sugar, no fat.
It's very prescribed. It's very, there's a list of proteins, a list of carbohydrates, which is very small, list of vegetables, a list of fruits.
Okay. So, Dr. Walter, are there any side effects from doing the HCG diet?
Yeah, there's basically two side effects. One is for women who still have periods. It can sometimes change their period just for that cycle. A little bit shorter, a little bit longer, more cramping, less cramping, a little more bleeding, less bleeding. But by the time they're off the HCG, then that goes back to normal. The other side effect that we've almost eliminated is that sometimes if you look online, places will say people get weak or dizzy or lightheaded. And I think what happens is people really don't realize how dehydrated they can get, because if you have that much food and you go down to 500 calories, there's obviously less food. But there's also water in the food, and there's water in the potato chips and the hamburger and the buns and everything else. And over a few days, people don't drink as much water. So we really, really stress water drinking, and we hit that over and over again. And occasionally people call back and say, I don't feel good. The first thing we ask them is we discuss about the water intake that they have.
Okay. So people must be really excited if they're going to lose half a pound a day, and they do the 40 days.
Yeah.
Is there can they go right back on the HCG diet?
Usually it's a pretty intensive diet, so if they want to do a second round, if they have 50 or 100 pounds to lose, they can do multiple rounds worth of the diet, but usually there's a break of 6 weeks or sometimes even longer in between.
Okay.
The other thing that's important to realize is the diet's really the first of 2 phases, and there's 4 phases of the diet. The third and the fourth phase are more food and eventually bring the carbs back in, but we help you do that because otherwise, again, if you go back to old habits, you're just going to gain the weight back again.
Okay, and so just in closing, the HCG, that's a component, that's something that pregnant women produce in their body.
Yeah. We use a very small amount, and pregnant women get 100 times more sometimes or more. So we're not trying to make women look pregnant. We're not trying to, a man won't have a positive pregnancy test, a woman won't have a positive pregnancy test.
Okay.
We've checked that before.
Okay, that was my question, if that was going to happen.
It won't.
Okay, great.
And it doesn't make you feel like you're pregnant either.
Well, that's good.
Yeah.
The opposite of a diet, right? Exactly. Right. So, Dr. Walter, what is the highest weight loss that's been recorded here at Medical Aesthetics?
Our record over several sessions is 110 pounds. And
Wow.
we've had a number of people with just one cycle lose 40 pounds. But again, that's not what everybody does. That's really kind of the exception.
Okay, all right.
And most people don't need to lose 110 pounds.
Right, exactly. What a difference, though, 110 pounds. Wow.
It can be very life-changing.
All right, well, thank you so much for the information today about the
Thank you very
HCG diet. And thanks again, and thank you to Acton TV. And next, coming up, we're actually going to have a client of Medical Aesthetics. His name is Mark, and he's had amazing success on the HCG diet. So listen to what he has to say. And so the last thing I know we really wanted to touch base with you on is the HCG diet program. When you first came to the office, that was pretty much your main concern. You wanted to do the HCG diet. Can you explain the process that you've been through?
I did the injections. It's a low calorie. I mean, if you stick to it, I think they may have said that I hit their record. I lost 45 pounds in 43 days.
Wow.
So it really was a huge difference. And then I did it a second time, and that was probably good for about another 30 pounds.
Okay, great. Wow. And so when was that, Mark? When did you start?
I started in June.
Okay. And you've maintained the weight loss?
Yes.
After the program, right?
Yeah, I'm pretty close to, I mean, of course you gotta, keep an eye on it and, make sure you don't go off too much. But the reason why I did it, and for me, I tried low carbs and stuff like that, which years ago worked. The last time I tried low carbs, it didn't work. And for me, and I don't know what it would be for other people, but for me, it was like a miracle drug.
Really?
I mean, 43 days. And it is hard work, but when you're losing weight, a pound or more a day, it's pretty easy to stay motivated.
Right.
When you do other types of diets and you lose maybe 2 pounds in 2 weeks, it's really hard to stay motivated.
Sure. So with the program, you meet with the doctor, and when you sign up to do the program, you have injections that you do yourself, correct?
Correct.
Okay, and then there's a diet program that's included, and then you have a coach, correct? That helps you out if you have any questions.
Yes.
Okay. All of that seems to be doable I know it's difficult for guys to be on a diet. I mean, women, I think we're so used to it. But for you, it seems to really have worked and helped and pretty easy to follow even once the program's over.
Yeah, and like I said, just having fast results makes you stay motivated.
Mm-hmm.
I mean, how many times do you diet and, geez, you may spend a month and lose 4 or 5 pounds, and it's really hard to stay motivated for a long period of time.
Yeah.
So when you get to go out and buy new clothes every month, it's pretty easy.
I think we all would love that, wouldn't we?
Yeah.
So you did what? There's 2 different HCG programs, right? The 21-day and the 40-day. So were you on the 40-day, or did you do one of each?
No, on both times.
Okay. Okay.
But obviously, time I was closer to where I should be.
Mm-hmm.
So down.
Okay. So I hear you have a funny story about your license picture.
Yeah, I went in to go cash a check, and I handed my license, and they said, well, that's not you. So it was time to get a new license. Luckily, I knew somebody at the bank, but yeah, she was not going to cash the check for me.
That is amazing. So that was such a huge difference just from a headshot.
Yes.
Wow. So have people been noticing? I mean, they must have to have noticed your weight loss.
Yeah, I mean, of course, everybody notices, and of course, everybody says, oh, you look 20 years younger. Mm-hmm. So that's always good.
That's good. And just quickly, just talk a little bit about Dr. Walter and the office and how you feel how you were treated as a patient.
Oh, it's very comfortable going there. You don't feel, of course, guys going in for, diet stuff feels a little weird, and they make you feel right at home. And then, of course, they have other programs there, so that's where I saw the PRP, which I play a lot of tennis, and some of my friends have had it done outside the country. So I was shocked to hear that you could get it done in the country.
Okay.
And the price was very reasonable. So I jumped on that the minute I found out about it.
Okay, and so you live in New York, and there was nobody closer to you, correct, that could give all these treatments for you and make it so comfortable for you?
I don't know. The HCG, I never found anybody closer.
Okay.
The PRP, just because of being there, and of course, once you meet these people, you're comfortable. Mm-hmm. I don't know somewhere else anyways.
Right.
So, yeah, a lot of that had to do with you're just comfortable there.
Okay.
So, I mean, I would not go anywhere else at this point, even though there may be somewhere closer.
Mm-hmm. Well, that speaks volumes then for Dr. Walter and the staff at Medical Aesthetics of New England. That's great.
Yes, it is. They're really great there.
Great. Thank you so much.
No problem.